Solutions employed. All solutions to be employed in the urethra or bladder should be made freshly with boiled water in the manner described in Chapter 3. The following list represents the solutions usually employed, the form in which they are most conveniently kept, and the strength in which they are usually dissolved. The list might be doubled or trebled without being exhaustive. The remedies are classified in a purely arbitrary way. Manufacturers' claims as to silver content of the organic compounds are disregarded as being of no clinical importance. Name, form, injection, irrigation, installation. Argyrol, Prodergol, Albergin, potassium permanganate, silver nitrate, silver permanganate, mercury oxycyanide, zinc sulfate, zinc acetate, zinc permanganate, copper sulfate, vegetable astringents, ointments, and bougies. Must be retained 3 to 10 minutes in the urethra. First and foremost, let us condemn the use of any local anesthetic as a preliminary to urethral injection in acute gonorrhea. This masking of the natural irritative reaction is an unwarranted and dangerous procedure. The organic silver salts. War still rages as to the relative value of the organic salts of silver. Thus, Marshall and Neve, experimenting upon the Staphylococcus pyogenes aureus, showed that whereas the majority of silver salts experimented with were powerfully bactericidal, argyrol showed no such effect. Cragen, comparing the effects of silver nitrate, Prodergol, and argyrol on Streptococcus, Staphylococcus pyogenes aureus, and Gonococcus, showed both the latter to be markedly inefficient except against the Gonococcus, which was killed in 30 seconds by 5% Prodergol and 20% argyrol, in 3 minutes by 2%, and in 12 minutes by 1% Prodergol, in 20 minutes by 10% argyrol. Burnett, experimenting on dogs, found that neither argyrol nor silver nitrate showed any power to penetrate the urethral mucous membrane. The report of Puckner and its discussion exemplifies the impracticability of classifying these salts by any laboratory standard. The only standard is that of the clinic. The clinic decides that the organic silver salts are, by virtue of their power to destroy gonococci and their relative lack of irritation to the urethral mucous membrane, the best remedies against acute gonorrhea, and useful in chronic gonorrhea in proportion as the urethra is hypersensitive and irritable to other remedies. But in non-gonorrheal or post-gonorrheal urethritis, acute or chronic, the organic silver salts are all but useless. Argyrol. Argyrol is the least irritating of these remedies and is accordingly the most useful in acute gonorrhea. Yet even argyrol may irritate. I have seen 3 patients who could not employ it, and 2 others with prostatic abscess due to its intemperate use. Yet argyrol is so filthy that one gladly employs one of the other salts in its stead as soon as the urethra will permit. The stains of argyrol may be removed by immediate washing or by prolonged soaking in 1 to 500 corrosive sublimate solution. Prodergol. This is fully as efficient as argyrol, but in efficient strength, more irritating. Albergin. Albergin is efficient, but somewhat more irritating than Prodergol.